Just to recap on what we did when the calves arrived back in the first week of May. We vaccinated with a modified live respiratory vaccine, which was Bovishield Gold. Number 2, the Martin-Gatton hemolytica toxoid we did not do here, and I don't think we did it at any of the 3 locations. The Clostridial bacterium, we used Ultrabac 7. We used Dectomax injectable for our external parasite control. And then they of course didn't have any to castrate or dehorn, right? None here. Implanted on later on. When the booster was given, 21 days later is when the implants were done. They also mass treated everything that arrived here in the 1st of May. They used LA300, which is very similar to this Tetradur, which is a type of long-acting tetracycline. They did have some respiratory illness and ended up coming back with Draxxin on May the 18th. Draxxin is this drug here. It's one of the most popular to treat respiratory disease. It is expensive, $480 for a 100 cc bottle. So, you know, and one injection is going to cost well over $20 a dose. Very effective drug, has a long duration of action, so it is definitely one of the most popular to use. As far as antibiotic selection and how you go about selecting an antibiotic, it's all based on what family they come from. That shows what family they come from is actually how they work on the bacteria. One of the bacteria we deal with that's a real problem is Mycoplasma bovis, and that's generally later. You know, it's early on in pneumonia, it's Martin-Gatton hemolytica, and that's where Exceed really shines, and Draxxin. But as you go later and you've treated a couple of times and you're like a week into treatment is when Mycoplasma bovis tends to take over. It has no cell wall. So people always ask me, should I use Exceed after a week? And it's no, don't use Exceed because it has absolutely no effect on Mycoplasma at all. So you're basically not hitting it at all. So think Exceed early on in treatment, and later on when Mycoplasma becomes more dominant is when you start thinking LA300, because tetracycline is definitely the drug of choice. Evaluating treatment response, so how do you know your treatments are actually making a difference? Of course they're going to look better, their temperature is going to go back to normal, but really the best way to tell is weight gain and appetite improvement. So if you can take weights when you treat, and then as you think they're responding, keep taking weights and make sure that they're picking up weight, and that's a great way to assess your treatment. As post-treatment intervals, how long do you wait before you come back with a second dose? And now it doesn't have to be a second dose of the same drug, but a second dose of any drug. A lot of the medications we have now, especially the very expensive ones, have a long duration of action. So you want to wait a little bit, give it a chance to work. Mycotil, Batril, and Nuflor, about 3 days on those. Exceed 5 days. Draxxin, you can go 5 to 7 days before you even treat a second time. We have a lot of problems with, this is an antibiotic sensitivity from our diagnostic lab, and this is what we're seeing pretty much all the time. This is not a rare occurrence. This is most of the time when we culture Martin-Gatton hemolytica, which is again the bacteria that causes most pneumonia. You can see over here on the right column, almost every drug is resistant. Seeing lots and lots of antibiotic resistance now. Ceftiofur, which is Exceed, is susceptible. Very much so in the lab, maybe not so much on the farm. The other susceptible drug is Thiamulin, which is a swine drug. We don't even use it in cattle. So that's where we're going to run into some problems, is that we're getting so much antibiotic resistance. So keys to success, you got to control your early death loss from Mannheimia hemolytica, which we did here, using the LA 300 on arrival, and then retreating with Draxin. Control chronics and non-responders, which we did not have. We didn't have any that didn't respond. And that's probably a function of our vaccination program. We used modified live respiratory vaccine. Got them on feed quickly. Didn't have to use any injectable mineral like multi-min. Sometimes people do. But in this case, and these come from farms, different farms, Roy, that had fairly good nutrition coming in.
We don't know.
You don't know? Okay. I didn't know that. I thought they were purchased locally. A lot of times the stockyard calves would benefit from a shot of 1 dose of multi-min, which is an injectable mineral, just to kind of bring their mineral level up. So many calves in our area have not seen any mineral ever. They've seen a lot of salt, or some salt, but very little mineral. So mass medication, like we did here, what they did is they just medicated everything. You can do it injectable. You can use feed additives, but it's hard to treat sick calves with a feed additive because they just don't consume enough. If you don't want to go that route where you treat everybody, you can take temperatures, treat everything over 104. A couple of feed additives, aureomycin is probably the most common that we use. We dewormed with Dectomax injectable, and then actually they gave another dose of dewormer here in 21 days, 3 weeks, which I was kind of surprised. And I thought, well, that seemed like it was a little bit close together. And then I started looking at persistency. Here's Dectomax injectable. This worm is the one we're after. And actually, Dectomax only works about 21 days. So it was a good move. It was good to go ahead and deworm again at 21 days on this group. They used Safeguard, which is a drench, and they used the ivermectin pour-on. So they used Safeguard, this one here, and that took care of all the internal parasites, and they used an ivermectin pour-on, just a generic, to take care of the external parasites. Had 1 case of polio down in Morgan County, I think it was. That is, they're also called brainers. This is actually clinically softening of the gray matter of the brain. The signs were acute onset of blindness, circling, running into things, ataxia, which means they're off balance, off feed. Some of these animals die very quickly, and some have clinical signs and then die. And then some of them respond to treatment. And again, this was the one they called Lazarus down there at Morgan County because they thought he was going to die. And polio is caused by an excess in sulfur in the diet. So some of the sources, excess sulfur, calcium sulfate or gypsum as a feed limiter, molasses and distiller's grains, especially from ethanol, and corn gluten, all can be high in sulfur. You can also get high sulfate water or fertilization with ammonium sulfate. And what happened in Morgan County, they were using distiller's grains, but the diet was fine. It really was not high in sulfate. But what happened was they were doing it in a self-feeder and had it open too much. And this one calf was very aggressive, and he was sorting. He was sorting through it to get the distillers. So he ended up just getting way more than he should have. And they ended up treating him with, the treatment for polio is thiamine, which is one of the B vitamins. And they were able to get some B complex in him and get him treated. And he has recovered fully. Lameness is another issue we deal with in this feeding period. They had one clinical lameness that they had to call the vet at Eden Shale. They actually had a severe foot rot. The calf went off feed and was non-weight bearing. The vet came out, had to lance the foot. They did multiple rounds of Exceed and copper tox. The swelling finally went down, and he's starting to put weight on it and doing better, but you can imagine what it did to his weight gain. I haven't looked at their weights, but That's one of the problems that can occur, and probably was secondary to a bad foot rot. So what you have to be careful of, if you see, can we cut these lights, Roy, in the front where we can see this picture just a little better? So when you see a foot like this is almost always a foot rot calf. The swelling is equal on both sides. The claws are spread out because the infection is right in this interdigital area. It gets soft. That skin gets soft in there, especially when the ground is wet and or they're in mud, especially like around watering troughs. So that gets wet, and then they have some trauma to it from rocks or brush or stumps, thorns, something like that will make a cut, and it gets infected. So that starts a foot rot problem like this. And if this is left untreated, it can actually enter into further up in the hoof and get into the bone, can get into the joint, and cause some big time problem. So if you have a lameness case that comes up, first thing you want to do is assess the swelling and see, you can look at the distance between the dew claws. I mean, obviously these are much wider than these, so you know that swelling is present. Next thing to assess would be the size of the bulbs of the heel. And you can see on this side they're both even. On this side, this right claw or the lateral claw is much, much larger. And the swelling is really not symmetrical. You've got much, much more swelling on this right side. So this is not a case of foot rot. Foot rot's going to be right in the center. This actually is going to be a problem in this claw. Probably an abscess in this claw that needs to be worked on. So once you get in the deep digital sepsis, where you're getting into some structures deep in the hoof, that becomes a real big problem. These need to be treated just like this, either on a table or actually give them some medication to make them go to sleep, some anesthesia, and then you can actually work on that foot, drain the abscess, and treat with antibiotics. This was a case from the UK farm. These were on a feeding trial, and this started as a case of foot rot. And they treated it a couple of times, but not very aggressively. And it actually did get into the deeper structures of the foot. And we ended up having to euthanize this calf, and he ended up over at our lab. So that's a kind of close-up picture of it. You can see there's so much swelling at this point. It goes all the way up the leg. When we sectioned it, we cut the foot off and then took a cross-section of it. This actually started as a case of foot rot, came right up through the interdigital area, through the skin, and came up into, this was the tendon sheath, and basically just ate that tendon sheath up. So all that's infected. These are the bones of the foot. They were also affected, so you've got what they call an osteitis, which is inflammation and infection of the bone. And that's another shot of it there. So this was a situation that probably could have been alleviated had we gotten to it a little bit faster, maybe a little more aggressively. So the bottom line is, don't let your lameness wait. If you get a lameness case, get it in and treat it, because they do respond really quickly to medication, especially penicillin. Penicillin's a cheap drug and probably the best one on feet. So. And there's another shot of it. So again, here's your bones of the foot, and all of this was just infection that had eaten out all along the tendon sheath. So foot rot is also called interdigital necrobacillosis. It starts with that crack right there, and then it has a very foul odor as it gets as the infection progresses. So drugs approved: Draxxin, Exceed, Nuflor, Naxel, Exenel, Albon, oxytetracycline. There's lots of them approved for foot rot. Again, penicillin's probably the number one because the organisms that infect the hoof are usually anaerobic, and those are best treated with penicillin. There are some lameness conditions without a lot of swelling. There's digital or interdigital dermatitis, which is the heel warts. We see a lot of those in dairy, not so much in beef. Ulcers on the sole, laminitis, subsolar and toe abscesses, things of this nature that are down in the hoof don't have a lot of swelling until it goes deeper into the bones or the joints. Laminitis is probably one you want to watch for because you've got these animals usually on a pretty high level of nutrition and grain. So they're with a laminitis situation, we describe that as walking on eggshells. They're very, very tender on their feet. They tend to what's called camp out. They try to keep all of their legs directly under them or kind of in towards the middle, so that they're not putting so much weight on them. They try to get the weight off of those feet as best they can. Pinkeye was another problem we encountered. I think pinkeye was, oh my goodness, who had the pinkeye? I guess it was up at Eden Shale. In June, treated with LA300 and it responded well. Pinkeye has a couple of different agents usually involved, Moraxella bovis, Moraxella ovis. Transmission is with face flies generally. That's why we see so much of it in the summertime. Treatment, they usually do respond to long-acting tetracycline, or if they don't respond to LA300, they generally will to Nuflor. Some people use penicillin and dexamethasone and inject it underneath the eyelid. And then Exceed and Draxin can also be used to treat. And somebody always asks me, can you use tetracycline in the eye? And it's not a good idea. Tetracycline is very irritating, so never inject it in the eye. Definitely never inject it. If you squirt it in there, they're going to squint a lot, their eye's going to water a lot because it is very irritating and acidic. So just be really careful. You can damage the structures in the eye with tetracycline. On the left, advanced case, when pinkeye gets very advanced, you can see some deep corneal ulcers and can actually progress to a rupture. So to prevent pinkeye, we want to make sure that these animals have some shade because sun will damage the cornea. And controlling face flies, clipping pastures. Make sure you got a good clean water source because they've got to drink. If they don't drink plenty of water, their eyes are going to dry out, be more likely to get some lesions. Treatments, again, antibiotics, long-acting antibiotics, best to give injectable rather than just treat in the eye because what happens when you treat in the eye? You squirt something in it. It gets rinsed out pretty fast. It doesn't hang around very long. So your best bet, injectable antibiotics. You can use a patch if you want to kind of protect the eye. Just realize that sometimes the eyes do get really bad and you've lost your ability to see what's going on. I've taken patches off before and seen some pretty nasty stuff. You know, if the eye popped out or they got maggots or something of that nature, and you just don't see it happening with a patch on. What I use for myself, I either suture the eyelids together or use a third eyelid flap to kind of stabilize the eye in really, really bad cases. Usually that's not necessary. Topical sprays, we talked about that, get rinsed out pretty quickly. And then I get asked quite a bit about pinkeye versus the respiratory virus, IBR. How do you tell the difference? With pinkeye, you're going to have always an ulcer in the center of the eye or maybe a little bit offset, versus IBR is usually more of a conjunctivitis where you get actually swelling of the tissues around the eye. So there's kind of the difference there. Coccidia is one we actually didn't have in any of the calves that are on at least so far. We may have it yet. But coccidia can cause bloody diarrhea, often seen in this age calf. Treatment would be Corid or Amprolium crumbles. It's a 5-day treatment, very easy to do. Bloat, we did not have any of either. More of a, generally in calves, we deal with it more so in the spring when they're on that very immature clover. Don't think we had any ringworm. If we did, I didn't hear about it, but of course you don't, I'm sure they wouldn't tell me because there's not a whole lot we can do with ringworm. I always tell people it's a little bit like pimples in teenagers. They just kind of go through it. It's a stage they go through with ringworm and with warts as well, where they're just kind of susceptible to these skin diseases. Seems to be right about the yearling phase. Did have a good case of warts. I think that was, maybe that was at Morgan County. They gave somebody a wart vaccine. Does anybody use wart vaccine? Nobody's used wart vaccine. Well, if you get one like this that's really bad, you can use wart vaccine. Probably the more traditional way to treat a warty calf is to pull the warts off and actually either grind them up and feed them back to the calf, or you can actually take the wart off and rub it into the blood where it's bleeding, and it kind of stimulates the body, just stimulates the body to work against that virus. These viruses are really, they're very benign, so they don't stimulate a good immune response. And I think that's all of the disorders that I could think of in this time frame, and I think I covered all of them that we had out of these groups. Any questions?
On treating foot rot with penicillin,
Yeah.
you would have to do multiple injections, I guess, or how would you do this?
What I usually do is give the long-acting, the BP48. So, and usually one good dose of it would take care of it if I caught it early. And then if not, if I didn't see a good response within about 5 days, I'd get them up for a second dose. But generally speaking, I could knock it out in one at a dose of 5 cc's per 100 under the skin. Do you like something better?
No, I never realized we could use penicillin.
It works very well.
Using Draxxin because it's quick and easy.
You'll actually see, I bet you see better results on penicillin. We've lost a lot of our good drugs just because these others who've come in, they get advertised a lot more. And we do have some other ones that still work. This is one with fescue toxicosis here. This was actually one of my cows. She would find any mud hole that she could find and stay in it. It's as soon as it got warm, I guess it was around 9:30, 10 o'clock in the morning, she'd find a mud hole and stay there all day. And sometime around 5 o'clock, come out and finally start grazing. So these end up culling themselves because they finally don't get bred on time and you end up getting them sold. Pretty classic though. They'll find them any mud hole and just stand there all day long. Finally, when it gets really hot, they'll start to pant.